Hi, my name is Natasha Mendez, and this is a systematic review critique of a journal article entitled Patient Subjective Experience and Satisfaction During a Perioperative Period in the Day Surgery Setting, a Systematic Review. It starts off with the problem. The researchers clearly stated the problem, which was no systematic review had been conducted that specifically aimed to gain an understanding of how nursing interventions and care experienced by patients and how this contributes to patient satisfaction with their perioperative experience. According to Pollack and Beck, the researchers should begin with a research question or focus of the investigation, and the scope should be broad enough to fully capture the phenomena and interests which the researchers accomplished in this study. This topic is important to nursing because during the past decade, the number of day surgery procedures has increased dramatically, according to Rhodes et al., because the pressure put on healthcare providers to provide a more efficient service at a lower cost. According to Pollack and Beck, the findings for the study should be meaningful to clinicians, other researchers, and policymakers. In this specific case, the phenomenon relates to nursing. The researchers described the phenomena clearly and stated it was the patient's subjective experience of perioperative care in the day surgery setting, and this relates to their subjective satisfaction with nursing care during the period. The search strategy. The researchers explained their criteria for selecting primary studies, such as qualitative studies, that they must be phenomenological and grounded theories. The researchers did not see cause and effect relationships between variables. These are just a few of the criterion used. The criterion selected was justifiable because it was specifically related to the research question of the study. According to Pollack and Beck, the sample of the primary studies based on specifications of the exclusion and inclusion criteria for the search. The researchers identified a list of databases used and listed them within the study as well in Appendix 1. The key search words were also identified. Pollack and Beck state that searching mainstream electronic databases can be difficult for qualitative studies, but improvements have been made in databases such as Medline and CINAHL, which were both used in this study. Pollack and Beck recommend using search words such as grounded theory and phenomenologically. However, I could say that word last week. However, the researchers did not use these keywords. Their list was extensive, and this could be viewed in Appendix 1. As part of the supplementary efforts, the researchers did do a manual search of relevant key journals not available online. Pollack and Beck state that using alternative searches has advantages such as adding a more comprehensive analysis. They also recommend hand-searching journals, especially when looking for literature more than a decade old, because computerized indexing systems were less sophisticated before the mid-1990s. The Prisma flowchart was not included in this study. Pollack and Beck state researchers should describe the sample, selected studies, and summarize it in a table, but highlighting the sample decisions in a Prisma flowchart is ideal. Number 3, the sample. The inclusion and exclusion criteria was clearly articulated. A few criterion to mention in the study: it had to be qualitative. They had to explore the patient experience of day surgery and what it was meant in terms of their satisfaction with care, and the participants had to be at least 18 years old. This was justifiable again because it relates back to the researchers' research question. According to Pollack and Beck, the researchers need to include specifications of the exclusion or inclusion criteria for the search. Sampling criteria typically covers substantive methodologic, and practical elements. 5 studies met the search criteria inclusion criteria. The researchers did not discuss the strength and limitations of the samples, only the levels of evidence for the samples, which will later be discussed in the data analysis section of this critique. Pollack and Beck state that the sample sizes in metasynthesis are highly variable and give an example that it can range from 3 to 300 primary studies. The sample size is likely to vary based on the extent of the prior research. The researchers did not mention any of the original reports that were lacking any key information. The researchers did exclude several studies from their research. All of the studies excluded are listed in Appendix 3 along with their reason for exclusion. Pollack and Beck state that the analysts need to decide how the quality assessments will be made and what will be done with that information. In this case, the studies not meeting the criteria did not make the final study sample, and the explanations were given. Number 4, quality appraisal. The researchers used the Query appraisal criteria to appraise the primary summary. The Query software used to manage, appraise, analyze, and synthesize the data was developed by the Joanna Briggs Institute. Pollack and Beck state that the researchers should perform some type of quality assessment of primary studies for the purpose of being able to describe the sample of studies in the review. In regards to the appraisal scale, Pollack and Beck state that the quality criteria varies from instrument to instrument, and the results are rated differently with different assessment tools or by different raters using the same tools. For this reason, it's difficult to rate the appraisal tools consistently. The study reported 2 researchers independently and critically appraised both studies for relevance and methodological quality. Pollack and Beck state it's preferable to have at least 2 researchers. Having 2 researchers helps minimize subjectivity and decrease the workload. Intercoder reliability was not discussed with the readers, but Pollack and Beck state that it should be calculated to demonstrate the rater agreement on the study quality elements was accurate. The appraisal information was used in a well-defined manner in the analysis by the results and clearly labeled tables the researchers presented. Number 5, data extraction. The researchers adequately described their methods for collecting the data using the Query data extraction instrument described by the researchers in Appendix 6. Pollack and Beck state the important methodological information to be extracted and included in the study includes data source, characteristics of the sample, and the methodologic features. The studies adequately extracted sufficient information. The researchers presented their findings in tables 2, 3, and 4. They also discussed their findings and details in the results sections of the findings. Pollack and Beck state the most important information extracted from the data extraction process is the study findings and that they must be recorded. They also state tables and figures play a key role in the reports of the systematic reviews. As stated earlier, 2 researchers did independently and critically appraise both studies for relevance and methodological quality to ensure the integrity of the data set. And the benefits of the 2 researchers was previously stated according to Pollack and Beck. Number 6, data analysis general. The researchers explained their method of pooling and integrating the data using the Query software. The researchers started with 29 studies. 12 of the studies were entered into the Query software, and the findings were grouped into 6 categories. The synthesized findings derived from the metasynthesis were education and information, communication, and privacy. The analysis of the data was credible and thorough. The researchers used the Query software levels of evidence and 3 levels of degree of credibility were displayed. Only 5 of the studies were unequivocal and included in the study. The researchers had several tables and appendices to display of the results and the data collected from the study. Everything was clearly labeled and referenced. The appendices were very useful because it had a list of the key words, the key search words, the studies they excluded and why, the studies that were included, the query appraisal instrument, and the narrative summaries included. According to Pollock and Beck, the tables and figures play an important key role in the systematic review, and typically there is a table showing the characteristics of the studies included in the review, such as tables 2, 3, and 4. Number 7, data analysis for qualitative studies. The researchers did not discuss comparing the findings of each study. Rather, they presented all the data collected from the studies to the readers to view. However, the researchers did explain their methods for interpreting the data, as well as discussed in a previous question. A meta-summary did not take place in this study. Pollock and Beck do state that meta-summaries can lay the foundation for a meta-synthesis and involve developing a list of abstracted findings, the primary studies, and calculating the manifest effect sizes. Yes, the meta-synthesis achieved a fuller understanding of the phenomena to advance the knowledge. This is demonstrated by the researchers discussing the implications to nursing practice, which will later be discussed, and the critique of the conclusion of this study. That brings us to the conclusion. The researchers did not discuss the section of the study. The researchers did not discuss in the discussion section of the study any conclusions drawn about the quality, quantity, or consistency of evidence relating to the research question. Pollock and Beck do state that the researchers should discuss the overall summary of the findings, the quality of the body of the evidence, and the consistency of the findings across the studies. The researchers did mention that they only had 5 studies that met their inclusion criteria, 3 of which were included as narratives and rated as credible. This was the only limitation discussed by the researchers. According to Pollock and Beck, discussing the inconsistency of a study is important to include in the discussion portion of the study. Lastly, the researchers clearly stated their implications for practice and further research. Examples of implications for nursing practice include the importance of pre-admission contact, specific education and information, maintaining patient privacy throughout the continuum of care, and many more. Pollock and Beck state the conclusion researchers should discuss implications and further research needed to improve the evidence base. That concludes the critique of this systematic review. Thank you very much, and the research cited for this article includes Pollock and Beck 2012. Thank you.